So having established what the fundamental anatomical structures are that make up the respiratory system, let's start looking at how it works to achieve its function. So we said there were three parts to the respiratory system's role. One was pulmonary ventilation, getting air in and out from the atmosphere inside your lungs. The second was external respiration, getting that oxygen from that air into your capillaries. And the third was internal respiration, getting the oxygen now in your blood to diffuse into the muscle cells. And this video primarily looks at how we achieve pulmonary ventilation, that first contribution of the respiratory system. So the physical breathing mechanics or movements that allow us to move air from the outside, inside, and vice versa. Have a little browse at the specification. So we need to know how this works at rest, and the muscles, so the muscles are in red, the muscles that contribute to making us breathe in and out at rest, and also how we can do this during exercise and what changes there might be. And you can see already that there are additional muscles which we use when we breathe in and out during exercise. So three parts to the situation, as the respiratory system, as I said, and we're focusing in this video on pulmonary ventilation. Again, pause the video, have a little look at this. It's a very simplistic diagram to show how we breathe in, so how we inhale or inspire, and also how we breathe out, how we exhale or expire. The diaphragm is critical in these movements, and the rib cage movement. So you can see here when we breathe in, our rib cage expands as the ribs, or as the muscles pull the rib cage up and out. So when we breathe in, our rib cage goes up and out, and our diaphragm actually flattens. When it's at rest, it's very dome shaped. When it's contracting, it flattens more. So the rib cage movements and the diaphragm movements and the muscles that make those movements happen are central to the breathing mechanics. And I think the best way to remember this is to go through this process. MVP. You might have heard of a phrase, most valuable player, MVP. And if they were the most valuable player in terms of grading, they'd be an A grade. So you could perhaps remember MVPA. And this refers to the muscles and movement that occurs to create a change in volume of the lungs, of the thorax, the chest cavity. And that change in volume will influence the pressure inside the lungs, inside the alveoli. And that's a pressure that's relative to outside, the atmosphere. And then finally, as a result of this muscular impact, the volume change, and therefore the pressure change, air will flow. And air typically flows from a high to a low pressure. So let's apply that to breathing in or inspiration at rest. So the two, M was, if you remember, M was muscles and movement. And basically we've got two muscles that contribute to you breathing in. We've got the diaphragm muscle, that sheet of muscle at the bottom of the chest cavity. And when that contracts, it flattens and lowers. And then we've got the the external intercostal muscles. And these are muscles which are essentially between the ribs, and they work, when these external muscles work, they pull the rib cage up and out. Now those actions and those contractions create a volume change. So the rib cage moving up and out and the diaphragm flattening increases the lung volume, the space inside the lungs. So as a result of these muscular movements, the lung volume increases. Now the thing to remember with volume and pressure is that they do opposites. So where you have an increase in volume, you'll have a decrease in pressure inside the lungs. Again, remember that it means that the alveolar pressure or the lung pressure will be less than the atmospheric pressure outside. So it's relative to the atmospheric pressure. And then as a result of that, we know things typically move from high to low. So if we're saying there's a lower pressure inside than a higher pressure outside, air will move from the outside in. And that's obviously what we want when we breathe in at rest, or at end time really. Now tidal volume is the volume of air that you breathe in and out, the amount of air that you breathe in and out per breath. And at rest you breathe quite shallowly, so tidal volume in this instance will be quite low. And you can see here, they're in summary, the process of inspiration at rest is an active process, and the reason we describe it as an active is because muscles basically contract to make it happen. The diaphragm and external intercostal muscles make things initiate that movement. Now I mentioned that volume and pressure kind of work in opposites, and this is basically a law called Boyle's law. You might not need to put that into an exam question, it's probably a little bit of additional information, but you can see here that where there's a lower volume inside this jar, the pressure gauge is high, so low volume, high pressure. But when we increase the volume, increase the space, the pressure lowers. So this is the same kind of concept behind what happens in your lungs. Volume and pressure are inversely proportional. They do the opposite. So again, pause the video and just take the information in here really. We've got atmospheric pressure at 760 millimetres of mercury, and at rest the alveolar pressure is the same. Now when we breathe in, our rib cage moves up and out and our diaphragm flattens to increase the space. You can see the space here is a little bit bigger than here. And look what it's done. So now we've increased the volume inside the lungs. The alveolar pressure has dropped by 2 millimetres of mercury. So now we've got a higher pressure outside and a lower pressure inside. And you can see that air would move inwards until there's a balance, until it's equal. So this is inspiration, a high to a low pressure. When we breathe out, our diaphragm goes back to its dome-shaped position and the pressure changes, the ribcage drops and lowers and the volume inside drops. And you can see when the volume of the lungs drop, the pressure increases. So it's now gone up to 762, which is higher relative to the atmospheric pressure. So high to low, air will move outwards until there's balance. What about breathing out then? Expiration at rest. Well, essentially, this is pretty straightforward. Those respiratory muscles that we've talked about, the diaphragm and the intercostals, they purely relax. And when they relax, they go back to their normal position. So the diaphragm goes back to being dome-shaped and the external intercostal muscles relax and the rib cage will then move downwards and inwards. And when that occurs, the space inside the thorax, the volume inside the lungs decreases. So we're reducing the volume. And we now know that when we reduce volume, the pressure will increase. So the alveolar pressure increase relative to outside and air will move high to low from inside the alveoli to outside in the atmosphere. And again, in summary, expiration at this point, at rest, is passive. The reason it's described as passive because there's no muscular contraction involved. All these muscles did was relax. So it's a passive process. Again, pause the video and have a look at the description here. This might help you translate what we've just been talking about. But what about in exercise? Because again, we know that in exercise we typically breathe deeper and faster. So tidal volume is our breathing deeper. We breathe more per breath and we have to breathe faster. So it can't be just a sort of a relaxing process. It's got to be a bit more activated. So in order to breathe deeper, we have our external intercostal muscles and diaphragm. They do the same as they did at rest, but also we've got accessory muscles that help us breathe deeper and help us increase the volume even more. And there's a few names of muscles you need to know: sternocleidomastoid, scalenes and pectoralis minor. Now these three accessory muscles make us breathe in deeper, i.e. move our rib cage up and out even more than we did at rest. And if that occurs, we're moving our rib cage out even more, then the volume inside our lungs will be even larger. So we've got an even larger volume, and we know that there's going to be an inversely proportional decrease in pressure. So a much bigger increase in volume means a much more dramatic decrease in pressure relative to outside. And so even more air will come from high in the atmosphere to low inside the lungs. Air gets sucked in quite far, quite sort of dramatically. Again, logic says that that is what we need. We need more air with more oxygen to come in during exercise. And in summary, inspiration during exercise is active because those muscles, all of those muscles make this happen. Just a little visual there. Here's where sternocleidomastoid is. There's scalenes. Pec minor's not on this, but again it shows the other intercostal muscles which are situated between the ribs. And you can see we've got two layers. We've got a green outside external layer, and this is inside the lungs, this internal intercostals, and they come into play shortly. So breathing out during exercise, if you remember, breathing out at rest was a passive process. Our diaphragm and external intercostals literally just relaxed, and that's what allowed our rib cage to fall back down and in. However, given that we need to do this much more powerfully and quicker, we have helping muscles. So again, you can see our external intercostals and diaphragm relax as they did at rest, but we've also got some accessory muscles that help us force that action. We've got our internal intercostal muscles. They contract and pull the ribs down and in back to their normal position, actively pulling them in. We've also got other muscles like your abdominal muscles, rectus abdominis, and your latissimus dorsi, that contract also to exaggerate that forcing down and in action of the rib cage. So again, that makes it become an active process. So that dramatic drop in shape reduces the volume, which we know will dramatically increase the pressure inside our lungs, and therefore high to low air will be forced out, high in the lungs and lower in the atmosphere. So again, it's a much more forceful process. So in summary, expiration in exercise is an active process. At rest, expiration was passive because muscles didn't contract to make it happen. But we know we've got our accessory muscles and our internal intercostals that contract to forcibly make the rib cage move. So expiration in exercise is an active process. Again, pause the video, have a read of this. This explains it a little bit more. And then finally, I've put together a summary slide that goes through rest and exercise, inspiration, expiration, inspiration, expiration, with our MVPA way of trying to remember these processes. Finally, just a little example of what you might get. So performer at rest, the question is asking you specifically just to talk about what's occurring at rest. So any description of exercise is irrelevant in this question. It's asking you to describe the mechanics of breathing during both inspiration and expiration. So going back to the previous slide, it wants you to talk about these two processes. You might get a question that asks you to do that for exercise. You might get a question that just asks you to do it for inspiration and not expiration. So very much make sure that you respond to what the question is asking you rather than everything you know about breathing mechanics.